Hi, my name is Brandon.
My name is Caitlin, and our dad is going to give us a tour of the rescue.
All right, guys, if you want to come up here, the first thing we're going to do is we're going to pull the stretcher out. We use the stretcher on every single call, and it carries most of our equipment. So if you can push this red button right here. So we get to the stretcher, and what do we have on here? Do you guys know what these are? With the cardiac monitor, we can look at people's heart. We can get their blood pressure. This is for adults.
I can't really put my arm down.
That's right, huh? So, you guys want to see what's in the bag? So
Why is there like a lock on this?
Ah, very good. But we have some medicines that are really special. They're what we call controlled narcotics, and that's what we have in this side over here. We need to make you sleep for a little bit so we can do certain things to help you get better. That's what those medicines are. Inside here is all the different medicines that we carry.
Looks like more needles.
We have a bunch of supplies because you never know if you have one patient or two patients. We always have to be ready for the worst, right?
A scope.
It's a stethoscope. And what do you do with a stethoscope?
Listen to people's heart.
Oh my gosh, that's weird.
Pretty cool, huh?
That's weird. Oh, I think I know what we use this for.
What do you think we do this
I
for?
know.
So if someone's having a hard time breathing or they're not breathing at all, we can breathe for them with this device. It's called a bag valve mask.
So basically like you're helping them breathe.
Exactly. Pretend this is the patient. We'll load it back in the rescue. We can climb back in and see what is inside the rescue. How about that?
Yeah.
Push real hard. Let's go climb in the back of the rescue and we'll check it out. So when we go to the hospital, one of the most important things we have to do is we have to call the hospital. Seminole County Rescue 36 to South Seminole Hospital.
Loud and clear, rescue.
So on that radio report, we would tell them, South Seminole Hospital, this is Rescue 36. We're coming inbound your facility emergency, which is lights and sirens, with a unstable or stable patient. And the most important thing for them is we'll be there in 5 minutes. So they know they have 5 minutes to stop playing and get ready for us. On the way to the hospital, there's a whole lot of stuff in this rescue that we can use. Up here, we have a whole bunch of different supplies. You know, just like at home, if you guys fall and hurt yourself and you have a big bump on your arm, what's the first thing that we do? Put an ice pack on it, right? Big pull.
The substances we will mix together
Yeah.
will get really cold really fast.
Is it as cold as ice?
Yeah.
Now we have to get to the hospital, right? You guys want to go to the front and see the front?
Yeah.
All right, let's go there. Since you're sitting over there on the officer seat, that's where the paramedic in charge gets to sit. As we're going to the call emergency, how do we turn on our lights? Push that button there. So you hear it light up, and now all of emergency lights are on. What do you think that is?
The siren.
You're in the front ready to drive to the hospital, right? Because that's the next step in the process is we take the patient to the hospital. Unfortunately, neither one of you have a driver's license, so we're gonna let someone else drive for us, but let's go to the hospital and check it out there, okay? All right, now that we're at the hospital, we have to get the patient inside. Do you guys want to help pull the stretcher out? Jump up high, scoot way back. If we're coming out of the back of the rescue, now you're a patient, this is how you come out of the rescue. And we're here at the hospital already. So we come up, we're gonna wheel you forward. And look, oh, here we are at the hospital with Dr. Goodman. Hey, Dr. Goodman, Paramedic Williams, Rescue 36, we have your patient here for you. What happens next once we bring the patient inside to you?
So they would bring you into one of the rooms, and once we do that, you'll see me walk in maybe a second or two after that, and once I get all the information, I'll be able to work with you and get you home or get you to where you need to be to take care of you as well as we can.
Thanks for the tour.